We will have the honor to have Mr. Antonio Parenti with us online. And I will also be joined by Thomas Straumits, who was the moderator of the first session. We'll try to tie all things together with a panel discussion after Antonio's introductory speech. We'll just see if we have we lost. Okay, let's see. So just an introduction, and then it will follow by, as you see on the screen. I'm not sure if I can pronounce your last name. Akenine, Daniel Akenine, Elisabetta Zanon, and we are. Oh, hi, Antonio.
Good afternoon.
Good afternoon. We had a very exciting theater session, how to communicate in new ways about brain health. So sorry if we kept you waiting. Very happy to see you.
Likewise, and I'm sorry I'm not been able to be in Stockholm with you, but it was complicated this time around, I must admit.
Indeed, we understand, and we're so happy to see you online. So very welcome to Focus Patient Future Days. And we have had a whole day about brain health today in many different angles, and also talked about the connections with the cardiovascular disease, cancer, diabetes, and so on. So I think you handle it all, don't you?
Precisely. That's part of the work of my directorate, and it's more and more intertwined with one with the other. So indeed, cardiovascular and cancer these days a bit more connected than they used to be. Also because we are learning for the cardiovascular action plan from what has been done in the cancer. So there is the connection is becoming stricter and to a large extent mutually beneficial, or at least that's our intention.
Yeah. So we're looking forward to hear your introductory speech, and then we will have this panel coming on together with you. So please.
Excellent. Well, as I said, I'm very pleased to address you in this important event on the focuses of the future of healthcare, non-communicable diseases and brain health. And I'm very sorry of not being able to be with you in Stockholm. As I was saying, stepping up our work on preventive health and addressing the significant burden of non-communicable diseases are key priorities, policies for this commission, which was clearly reflected in the political guidelines that were presented by President von der Leyen to Commissioner Varela in his mission letter. And Commissioner Varela, as you know, is responsible for health. At the European level, addressing these challenges means providing comprehensive support to member states across the care continuum. So from public health policies and action to strengthening the healthcare workforce and health system. And prevention is always better than the cure. It is the most cost-effective way of addressing the significant burden of non-communicable diseases and the major risk factors for those diseases. In fact, as we know from the 2024 Health at a Glance Europe report, a return for every euro invested in well-designed public health intervention brings up to 14 euros of economic benefits, including reduced health care and increased productivity. Now, non-communicable diseases, such as cardiovascular diseases and cancer, are responsible for about 80% of the disease burden in the European Union. And action on health promotion and and disease prevention can reduce it by as much as 70%. So you can see the impact, which can be measured by these type of activities. And in addition to this, the OECD modeling shows that the four major non-communicable diseases, so cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes, account for more than 40%, 46 to be precise, of premature deaths in the European Union, with a risk of increase of mental health problems by up to 25%. This is an incredible burden on our health system, in our society and economy, and is increasing and therefore requires a quick and decisive response. So I am pleased that we already have some major policy framework in place to enhance health promotion and disease prevention at the EU level. First, we had, back in 2022, the Healthier Together initiative, which is our main strategic framework with which we support member states and stakeholders in the prevention and management of non-communicable diseases. And under this initiative, the Commission has already provided 280 million from the EU for Health program to support collaborative work between member states, that so-called joint actions, stakeholder-led projects, and contribution agreement with international organizations. Let me give you a few examples. First, the joint action Prevent NCDs, which is supported with 76 million euros, and where member states work together on the prevention of non-communicable diseases and the risk factor, but also the joint action Jacadi, which is supported by 53 million by the EU, and that focuses on cardiovascular disease and diabetes. The recently adopted health package is about, as the number of legislative and political documents we adopted back in December last year, is about safeguarding our unique healthcare model and shaping it for the future, a future where innovation becomes very important, thrives, prevention is stronger, and Europeans have access to the best treatment. In that context, we adopted the first ever cardiovascular health plan, as you mentioned, is part of the work of my directorate, which now goes out on the name of the Safeguard Plans. In the Safeguard Plans, there are 10 flagship initiatives that each have an EU added value and aim to strengthen prevention through targeted public health action, improve early detection and screening, and harness digital tools and innovation to modernize diagnosis and treatment. And through this plan, we will support member states in prevention, in fostering innovation, and in improving the access to high quality care. This will not only help to save lives, but also to prepare us for the future by building a healthier and more resilient EU. The Safe Heart Plan builds and complements, as I was saying a moment ago, Penilla, in our introduction chat, the European Beating Cancer Plan. In fact, cardiovascular disease and cancer often have the unfortunate commonality of sharing risk factors and comorbidities. Cancer as a comorbidity can furthermore affect treatment outcomes, quality of lives, and survival rates. So collaborative and well-designed actions are needed to prevent further increased pressure on the healthcare system, including in the area of healthcare workforce. As I said, the Safeguard Heart Plan builds on the cancer plan actions on prevention, screening, integrated care pathway, and on health inequalities. And the Commission is dedicated to ensuring that there is complementarity between the two initiatives, addressing diseases area which identify comorbidities such as cardiovascular diseases, including stroke. And for example, we have a creation of an EU cardiovascular health inequality dashboard, which is modeled right after the European Cancer Inequality Registry. And this evidence is incredibly important in the context of aging population, because by identifying gaps and highlighting key areas for action, that will support policymakers in guiding targeted investment and intervention at the national, but also at the regional level. Let me also recall the very recent fifth update of the European Cancer, the European Code Against Cancer, which has been launched last month, and it provides 14 evidence-based recommendation addressing personal behaviors, environmental factor, and medical intervention, and contribute to the prevention of non-communicable diseases in general. But our work does not stop here. There is indeed, as you can imagine, and as you well know, no health without mental health. And the Commission is very much aware that good mental health is equally important as physical health. So government and public health institutes alone cannot reduce the increase of and in the burden of mental health problems, and this must be a joint responsibility. Put it differently, if we want to be successful in preventing and managing mental health challenges, we need to work together. And this is why the Commission supports Member States in this task through the communication on comprehensive approach to mental health, which was adopted in 2023 and which contained 20 flagship initiatives in the course already implemented or in course of implementation, and which has a portfolio of 1.3 billion in funding opportunities. Here the Commission supports collaborative work between Member States on mental health through two joint actions, each supported by 6 million. One is Mentor, which promotes a mental health across all policies, approach, and pilots an innovative digital solution to improve mental health. The second is PRISM, which addresses the mental health of vulnerable groups and population through the transfer of best practices. So protecting mental health is an investment in people and in economies, and this is especially the case for children and young people. So together with UNICEF, we decided to develop a prevention toolkit on the mental and physical health of children and young people, because they need to navigate an increasingly digitalized world where excessive screen time and social media use can come with challenges that need to be urgently addressed. Under the Healthy Together initiative, in addition, the Commission supports collaboration between Member States on neurological disorder, and specifically on dementia. We have launched the Joint Action on Dementia and Health exactly last year. This 3-year collaboration between 15 Member States, Norway and Ukraine, led by Spain, will support the Member States in the reduction of burden of dementia and other neurological disorder. And the work will be done both at societal and personal level by improving prevention and early detection, education, and understanding of the diseases for relatives, care professionals, and other stakeholders. This action, which goes under the name of JADE Health, also aims to address dementia in a comprehensive way. So from improving health literacy and awareness, screening and primary prevention among a risk population group to support people living with it and other neurological disorder. This will be done by awareness raising, early detection, and delaying the onset of dementia through prevention. In order then to ensure synergy and regular exchange of information and experience, this joint action will collaborate close with other relevant initiatives, like the stakeholder project Care for Elders, that will help to improve dementia care by introducing innovative digital and personal-centered approaches by skilling earlier elderly care professionals, promoting early detection of dementia, and raising public awareness. And then we are also working very much, also under the leadership of the President, but also of our Commissioner, on working on the effect of social media on kids and young people in general. So as you can see, we have a comprehensive menu of action that look at prevention by now in a very holistic way, focusing in particular on the main problematic area, cancer, cardiovascular diseases, and comorbidities there. And with this type of action, we really hope to achieve in the next years a sensible reduction of the impact of these morbidities in the European population, which is extremely important as we are aging, because we need to age in much better condition. So with all of this, I would like to conclude and to say that I look forward very much to the panel discussion that we will be having afterwards. Thank you very much.
Much. Let's see. Yeah, now the sound is on. Thank you very much for that address. And while we're welcoming the panel up here on stage, I wanted to ask the first question, and thanks for highlighting the importance of non-communicable diseases and the disease burden, immense disease burden that we see with these diseases. As all our healthcare systems are struggling with aging populations, with multimorbidity and workforce shortages, what are some of the things you believe are important to address in order to make sure that we can work across organizational borders as opposed in the silos that we're operating in today?
I think largely you gave the reply to your questions. In the sense that what we really need to avoid is a silo mentality. This is something that we're trying to do at the European Commission level. We're working with a number of other DGs, DG Employment, for example, right now to see where there are synergies between our programs, or we're working with the Joint Research Center or the research and development part of our system. But the same should be done at national level. And it's very difficult, let's put it this way, and understandably so, sometimes from a financial perspective, to understand why you should be spending money now for something which is not visible in the short to medium term, because the short medium term is often the electoral cycle. But on the other hand, if we don't do this type of coordination, if we don't explore this type of synergies and we expand the role of prevention, then we are continuing to postpone a problem that we need to start solving today, because Europe is getting older. I mean, there's no way all statistics are telling us this. And to be able to grow older in a more comfortable way, with people are less of a burden to other people, but also the society in general, we need to work in prevention, to start working on it now.
Thank you very much. And while you were talking here and addressing that question, we've been joined up on the stage by a couple of panelists. So maybe we'll just start with a short introduction from my left to right. Go ahead.
Yes, my name is Liselotte Jansson. I'm the Secretary General of the Swedish Alzheimer Foundation.
Good afternoon. I am Elisabetta Zanon, Chief Executive of the European Cancer Organization.
And I'm Daniel Akenine. I work as the National Technology Officer for Microsoft.
And my name is Jessica Martinsson. I'm the CEO of SwedenBio, which is the trade organization for the Swedish life science industry.
And if we start with you, Jessica, Sif, yeah. When we talk about healthcare, of course, there is also a need for everything that is, the supply also healthcare. And you represent life science, and life science is actually both drugs and medtech, clinical studies, etc. So how do you see, you listen to Antonio and what is happening now, and maybe also what the future will be about the next few years. How do you think about the future for life science and to support healthcare in all its ways?
This was a massive question. I tend to think about things in a sort of business perspective, since my members are all companies. I think it's visionary to her listening in on what the Commission is thinking about how we can frame the European population. And hopefully that also, we talk about prevention. All these things will have a tool connected to it. Some diagnostics, because in order to be able to tell if we're improving, we need to be able to monitor. So I see that the life science industry is going to be the foundation for what's coming in the next years. And we will have, I mean, I'm also old, but the next generation, they will be very, very used to constant monitoring with watches and things like that. So I think it's data and understanding of disease progression that is really going to put Europe at the top. If we do this with ambition and some boldness, and combine that also with the European health data space, we will actually be able to create something that could be a unique thing from the European environment, which we also can sell. We will be able to create a better understanding on how to live a healthy life.
And you, I mean, Thomas, you also work with life science in your ordinary work.
Yes, I do.
So it's a natural transition to you also. And I mean, what we can see also, I mean, in your work, and I think Daniel's, is actually what you were dealing with just the other day when we mentioned data.
Yes, yeah, and health data and the ability for us to aggregate data in a good way and really make the most value of it today. If we just look at Sweden, it is it has always been a sort of a role model for health data in a way, but there are others now that are competing to win in that space. So I agree with you. Health data is an important one to manage non-communicable diseases also going forward. But if we sort of look in the next, 5-10 years ahead, what does good look like? How do we know that we have managed to address this enormous disease burden in a good way? Who would want to start with that question?
For all diseases, you mean, or?
Yeah, if we look at, we're now focusing on the non-communicable, that was a difficult word, diseases,
NCDs.
right? NCDs, yeah.
I can start. I can see some commonalities between the different diagnoses, whether if it's stroke or whatever it is. But I think it's a common lack of understanding in Sweden among politicians. Every speaker today has talked about the same issue. It's a focus on cost. Prevention is just a word. No one talks about. No one is doing anything about it. So I think we have a huge challenge to really have our politicians to really sort of implement these kind of things, regardless if it's stroke or if it's Alzheimer or shingles, whatever diagnosis. I think that's a very common thing, and I think it's time now that start talk and start to do something. And I think if we can work together among different diagnoses, I think we will be able, hopefully, to convince them, not looking at cost just for a cure or a treatment, but that working with prevention, for example, is the best cost reduction in the healthcare system. I think that's at least what I've heard today. It's a common theme for all diagnoses, whether it's shingles or Alzheimer or whatever it is. So I think we have a huge burden there or effort.
Yes, maybe I can continue and build on this. I think that success will look like if we manage to really overcome the silos that we currently have for the different diseases. We see that each disease is treated in isolation, or let's say this is what usually we do. We do not overcome this, let's say, this silos approach. Increasingly, of course, we have patients with comorbidities, more than one chronic condition. If I look, for example, at cancer patients, around half of all cancer patients, they have at least one other chronic condition. If we look at cancer patients above 65, then the percentage increases to, say, 70-80%. That they have more than one chronic condition. So it doesn't really make sense to address these conditions in isolation without looking at how we can provide an holistic type of care to the patients. How can we overcome these barriers? This is, of course, difficult because healthcare systems, they have operated like that for many years, and it's also the way clinicians are trained in their own disciplines. I think European health data space will help a lot in trying to bring together the puzzle, in a sense, by bringing together the data, the information, in a way which will allow also to overcome some of this fragmentation. But ultimately, it's also the workforce, it's also about education, training, is about involving patients more in the design of health services, so that we can really get the perspective of patients. And then, of course, this will lead to much better care for patients, and ultimately also cost savings for healthcare systems by treating patients in the best possible way. Patients with more than one condition, often they stay in hospital for longer. They cost more to the healthcare systems for their hospitalizations. They have a lot of side effects. So it's really important that we look at the future in a different way and try to address this aging population in a more holistic way.
Yeah, we have to redesign the care continuum in a way to do that. But Daniel, from your perspective, is emerging tech going to help us there? And if so, how?
Yes.
I guess that was an obvious question. The other one is more interesting. How?
Yeah.
How can emerging tech?
So how can success look like? I think if you think about the future, you could also look at the past to some extent. And my focus has been for almost 10 years, what can artificial intelligence do? And especially in this area, because this is a big opportunity for artificial intelligence. And if you look at it, maybe if we go back, artificial intelligence has been around in the healthcare industry for almost 10 years. When it came, 10 years ago, it was really about machine learning. So what can machine learning do? Well, it can, predict the future. So if you have a lot of data and you want to know what is the next data point, if you have, historical data, machine learning can help. And that is, of course, use cases, obviously, in the healthcare sector. But it really didn't stop there. So what happened in 2017, 2018 was a little bit of a revolution in AI. So what happened at that point in time was that suddenly we had not just, a lot of data, we had an enormous amount of data. We had new technology for compute. And we had some researchers that found that if you combine all of this with deep learning, suddenly you do have AI that have cognitive abilities. So we do have AI that can look at pictures, understand objects, understand what people are saying, all of these things that we couldn't really do before. And we applied that AI in the healthcare sector, for instance, in radiology. So typical use case, trying to find tumors. That was science fiction just a couple of years ago, and now we're using it. This has been tested, we are using it. And suddenly we had the ChatGPT moment. So now we can also generate things. It's not just looking at data, getting knowledge, you can actually generate things. So now we're using AI mainly for things like, well, if you have a patient, you want to document things, you want a summary of what has been said, it really helps the process. But it won't stop there. And now what I think will happen, during the next years is that this is going to continue in the form of agents. And what does that mean? What is an AI agent? Well, if you talk to ChatGPT, for instance, it has a lot of knowledge, but it doesn't do anything. So you have to do things. ChatGPT doesn't do anything. So still, you really need humans to actually act. What we are seeing now is that agents or AI gets agency. So it starts to do things. And when I look at some of the research that has been being done for, agents going out and, making diagnostics for patients. So Microsoft published a study this summer on the topic, trying to get the diagnostics for patients by asking them questions, ordering tests, doing all the things that a normal doctor does. And the results are amazing. They are really, really amazing. So what that tells me is that this technology is going to totally revolutionize the diagnostic case. We are not using it because we haven't tested it. It's not compliant. There's still things we need to do, but technology is there. It seems to work. And if you implement that, you're going to save incredible amount of money. It's doing less tests than a human physician does, so it will reduce cost in that case. It will spread that competence all around the world, etc. So I think there is enormous potential especially in diagnostics as a first start.
Thank you.
Thank you so much, and we will come back to that kind of track. But Antonio, we heard Liselotte from the Alzheimer Foundation said that, okay, the politicians just talking, and and we need to implement also the nice plans and strategies that are coming or decided. And since you are working at the European level, we know also from the fact, since I'm also part of the Cancer Mission Board, that it's not that easy sometimes to implement strategies and plans at the national level, even though the intention is very, very good. And everybody sits at the table and says, this will be good for us all in Europe. But how do we do it then?
Well, I wish I could have the silver bullet to respond to this question. What we do is push the member states to do certain things. I mean, take the Safe Heart Plan. The Safe Heart Plan will have inter alia the effect of pushing member states to create national cardiovascular plans modeled on the European one. And then we try to push them to understand where they can work together, and we finance that. I mean, the joint actions I was reading in my, or I was mentioning in my intervention, have precisely that aim, to try to push member states to work together to a certain extent, with us, of course, but also to learn from each other what can be best practices, what type of practices they can look and then necessarily adapt at national level. But indeed, there is often, how can I say, the need, and that generally it's also our task to try to push member states to do things that sometimes cannot be done. And that is a political decision. We take our political decision, we give it to the member states, and then it's the member states' political decision on what to do next. In the area of health, most of our competence of coordination and prodding, if you want to use that word, not solid hard rock legislative or other type of competences.
I think there is something very important in the Europe-Beating Cancer Plan that says, I mean, early detection. And we always talk about early detection. Of course, it's the best, or prevention. I mean, that's the best of things. But to have a proper diagnosis, to connect to what you said, Daniel, we of course need new tools also to use for proper diagnostics. If I go back to you, Liselotte, I mean, you are working with a major area on brain health. Dementia, Alzheimer is really something that it has affected people, not only those who have already, been having this disease, but also to other people around that are also worrying about Alzheimer and the diagnosis, also to have a proper diagnosis when we talk about Alzheimer, as an example. Do you think there will be in a soon future more tools to detect Alzheimer and also to cure it? How do you see it from your foundation and your work?
Yes, I mean, a lot of things have happened the last 5 or 10 years. For example, today, a Swedish researcher has developed tools for blood tests, blood diagnosis, which will actually help the primary care in order to put the first diagnosis. And we also know that a lot of AI tools is already used in terms of, with the eyes seeing and how you walk and things like that. So I work with a lot of researchers that are actually using these tools. So yes, I think because now we have the first treatment coming up in Sweden by Swedish researchers, and as soon as that will be approved, if it will be approved, combined with early diagnosis with blood tests and other type of tests with AI tools, and also combine that with the first modified treatments, then we have come far. We have come almost like they've done within HIV and AIDS. You cannot perhaps cure the disease, but you can live with it. So from my perspective, I mean, Sweden has some of the world's top scientists. The scientists are there, but we don't have the money. So, I mean, we are a big foundation and financer to the organization. I think that's another problem. You have to really, push in a lot of money into research right now because it's a momentum. And, if we can have Leqembi approved, and then when other companies coming after them, then I think we can probably have more disease-modified treatments within 5 years, and hopefully that will lead to a cure in 10 years. And I also, since I've been working in the IT industry myself, I think AI in terms of analysis, of course, but also an analysis, huge databases with information, as you said, Donna, in an absolute more rapid way. And also that you need to have physicians or researchers who will be able to understand the data, not just trusting ChatGPT. And I think that's the most important part when it comes to AI, and also from the clinicians to understand what information is AI giving me and how should I use it. But yes, I think there will come a lot of tools. It's hope.
There's hope, and that's really something we would like to give today.
Yeah.
Excellent.
Yeah.
Jessica, I think you were first.
I have two
Yes.
points I would like to make. The first is that I would like to add a little bit more of a context about the disease-modifying drug from our Swedish company, BioArctic. They just left, unfortunately, but it is approved, but it's not being reimbursed in Sweden. And honestly, we say that we are a leading life science nation, and we are. Swedish research has given this to the world, and the world is using it, and we are not. And that is such a disgrace for the Swedish system. Sorry, but I'm so upset about this, that we don't see that calculation being valid. If we don't use the inventions that has come out of Swedish research, what was the point? I am so disappointed about these decisions, to be honest. The other thing is that, the companies that I represent, the majority of them are highly involved in development of new treatments. For those types of therapies, regardless of indication, you always develop your drug together with some sort of diagnostic. It's super important to be able to find the right type of patients. So today's healthcare needs to be transformed into tomorrow's healthcare, and that means that every diagnosis is going to be needing some sort of advanced tests. That's just the future, and healthcare needs to prepare for that.
That also puts, the very, strong also point on the innovation uptake, which also goes for obviously technology and moving from small pilots to scaling, which was something that was discussed also in earlier seminars today. There are treatments, there are methods, there are methodologies, but they're not sort of taken up by healthcare in a systematic way to really drive the patient outcomes and also benefits. And I'm sure we'll come back to that. I think, Daniel, you had your hand up as well.
Yeah, just also a small comment on a possible way I think the kind of overall healthcare system also can change with AI, and that is, we have built up this system where you have persons that are generalists, so doctors that are generalists, and then you have, of course, specialists. And that's because you can't have one person, you know, being that knowledgeable. So the system has built up this generalization and this specialization. The interesting thing is that if you look at the data and the next generation AI, they are, of course, they are super good specialists because they have all of this, you know, in their mind, so to say. But they are also good generalists at the same time, which is a little bit surprising. And so that means that maybe actually in the future you will not have the system of first going to a generalist and then to a specialist, because you can actually work with the AI system that's both at the same time. That's also totally changing from the foundation of the system.
Absolutely, and I think that comes back to we are having all are having healthcare systems that are designed in a specific way today. But if we want to move to tomorrow, we've got to think differently. You know, we cannot just squeeze a bit of innovation in here and a bit of innovation in there. If the culture and general processes, you know, remain the same, then we're not going to see the effects that we have. Elisabetta, I think you also wanted to comment.
Yeah, maybe I can comment on something which was said earlier about the implementation at national level. You raised the question to Antonio earlier about the implementation at national level, and I think that if we look at Europe's Beating Cancer Plan, it has been really extremely important in driving action also at national level. I would like to stress this because what we have seen is really a dynamic somewhat which started in having this focus on cancer, in looking at having an implementation in national cancer plans of the same type of approach being taken at European level. So this, I think, is very, very important. Nevertheless, what, in my view, was missing in terms of really making a very meaningful change at national level was quantified targets. There are some targets in Europe's Beating Cancer Plan, quantified targets, I mean, but not that many. I think that moving to a situation where we really try to quantify what we want to achieve, I can give an example, survivorship. We can talk about survivorship for more common cancers at a certain level, survivorship for cancers with low prognosis at a lower level, of course. But if we try to move towards something which is more quantified, this is pushing more, in my view, member states to really try to put the necessary resources, means, and all the infrastructure which is needed to achieve those results. Of course, national health is national competence, so we can. Of course, we have to cope with these national competencies, but at the same time, we could at least aspirationally try to have some quantified targets being set at EU level.
Thank you so much. And I think the time is running up, and I would like you, Antonio, to just give a few reflections of what you heard the panelists also talked about. And I also would like to stress the fact that since I'm been an MP myself earlier, I know it's quite hard sometimes to implement things from the European Union at the national level, because people are not aware of the context sometimes, you know, that it's really important for healthcare or for life science or science in general or whatever it is, because also politicians are working in silos, unfortunately. So, but the final word will be yours, Antonio, so please.
Well, thank you for letting me finishing this panel. You know, the problem of communicating sometimes European policies is not something which is specifically related to health. It exists in many areas of our work. This is the result of a number of issues I think will probably require at least another 3 or 4 conferences to discuss. But indeed, especially in an area where, like the one of health, where we often work against the idea that health is specifically a national competence, then indeed we have to make, and we are trying to make an effort to give a better type of information to the European citizens. The European Beating Cancer Plan has had a very important type of campaign. We are on the verge of launching a few important campaigns for the Safe Art Plan. And we have tons of activities that we do in that area. Think, for example, on the cross-border healthcare directives. The problem is also reaching the right audience, which for us often means also normally the doctors, because then they can be aware of the instrument that exists. For example, to coordinate among themselves or to request different opinion from another doctor or a specialist in another part of the European Union. So these indeed are a problem which we are aware. We try to do with the limited means that we have the best and bring the best result. I think what is emerging also from the discussion that these actions at European level are useful, but we also need to integrate them in a changing context. I mean, there's been a lot of time mentioned what is coming from what has been coming and what is coming from AI, and there again, I think this is going to be a very important tool that will shape dramatically the way health is going to be given in the next decade or so. And we are trying ourselves to harness that, but indeed we need to do a lot of efforts, and these efforts are to be successful need the approach, the critical approach, the critical ideas of also of conferences like this. So on my side, if you want, from the political perspective, administrative perspective, what I would really like to do is to thank you for your initiative, because that allows us to keep on discussing and keep on sharing opinion and learning also, of course, from what has been discussed.
Thank you so much for attending us online. Antonia, Parenti, Liselotte, Elisabetta, Daniel, and Jessica. Thank you so much. And Thomas.
Oh, thank you.
Now I have also a very important message. The networking event will start at 6 o'clock. It's just one floor up. If you have any, what's the word in English? Sequence? Paljetter? Sequels. Do you know the small blinking?
Bling, bling.
Bling, bling. Yeah. If you have any bling, bling, you can bring it on, because we will really like you to have a good time. And I know Marit from the Breast Cancer Association, we will have our special boas. I'm not sure about the word in English either, but you will see. You will see. So you're all very welcome at 6 o'clock, and you will have now some rest, I think, and rest your brain maybe from this day. And we are very happy to see you all here. As we said from the beginning, Elisabetta, we have people from 9 countries here today, and we are very happy to see you all also tomorrow, hopefully. So have a good time this evening, and thank you all for today.